Welcome back to the 2021 Virtual World Cancer Leaders Summit. We have up to 600 leaders who have connected virtually to the summit platform so far, which is very, very exciting. And for our next summit conversation, Patient Perspectives on Innovation, we're going to be crossing over to the United States. We now have with us Suleika Jaouad, an American writer, advocate, motivational speaker, and also cancer survivor. And Suleika is joined in this conversation by Dave Craig, co-founder and CEO of GRYT Health. Dave, I hope I pronounced the company properly as well. We're going to be addressing questions from the audience to our speakers after the interviews, as we've been doing through the course of the day. So I would encourage you to ask your questions in the live question forum on the Summit platform, and then upvote the ones that you would most like to have answers. Goodness me, honestly, I've been doing this too long. Anyway, Suleika, let me come to you first. Now, as I understand it, you were diagnosed with leukemia at just 22 years of age. And from that experience, you then wrote Life Interrupted, the New York Times column, and a video series as well. So from your perspective as a cancer survivor, what information did you have, or what information do you wish you had had at the time with regards to new treatments or innovations that are out there in cancer care?
So I think you can't underestimate the overwhelm factor for a new patient. I remember sitting down for the first time with my medical team and feeling as if the medicalese they were speaking to me was a foreign language. There was so much I didn't understand. The learning curve was so steep, and all of this, of course, was unfolding in a moment that felt incredibly frightening and upsetting. But the other piece of it is that I think for a lot of patients, especially new patients, the question of where to find information and how to educate yourself is incredibly challenging. And we live in this WebMD age where for a lot of patients, the first stop for information isn't their doctor, it's the internet. And that was certainly true for me. I remember in that first week after my diagnosis, just a few days before I was scheduled to enter the hospital to begin chemotherapy, staying up late one night, doing some Googling and discovering among the list of side effects that came with the treatment that I was scheduled to do that infertility was among them. And this was something none of my doctors had mentioned to me. And at 22, it wasn't something I'd had the chance to really consider. And when I brought this up with my doctors, I made it clear that this was something that was important to me, and that the reason they decided not to mention infertility to me was because they didn't feel there was time for me to delay chemotherapy to undergo fertility preservation treatments. But at 22, the most thought I'd given to motherhood was how not to become one when I was ready. And I felt very strongly that any decision involving my body was one that I wanted to be a part of, not one that could be made on my behalf. So in the end, I did end up delaying chemotherapy to undergo egg freezing. But I think more than anything, it was my first indication that I was going to need to figure out how to become a better advocate for myself, and that access to the information that I needed so that I could make informed choices about treatments weren't always going to be a given. And more than that, that words like risk and value mean very different things to different patients, depending on their age, depending on their backgrounds, depending on their lifestyles.
It's just so fascinating speaking to you, Suleika, as someone who personally I've gone through infertility for a long, long time. And I was fortunate or unfortunate, I can't think of which way it is round, to have experienced it in my 30s. I don't know, had cancer been thrown into the mix as well, I don't know how I would have thought about my own future motherhood or not in my 20s. So it's just absolutely extraordinary that you were confronted with it and that you took it on as well. And kudos to you for taking the initiative and doing what was right for you as well, rather than just what a doctor is necessarily saying to you. In your videos, you say that what happens outside of the hospital is just as important as what happens inside of the hospital. What do you mean by that?
So, I was very fortunate to have friends who were there with me, to have my parents who became my primary caregivers. Um, and I think, so much of the focus ends up being on the patient instead of their caregiving support system. But the truth is, it doesn't matter how smart you are, how educated you might be. When you're not well enough to advocate for yourself, you need someone by your bedside doing that for you. So I was fortunate to have an incredible oncologist, the late Dr. Holland. And what I noticed in our very first few appointments was that he was spending just as much time getting to know me as he was getting to know my parents. And I realized this wasn't just because he was an incredibly compassionate doctor, which he was, but that he understood that what happened outside of the hospital was going to be just as crucial to my survival and recovery as what was happening within the hospital walls. And what I mean by that are things like, who is going to drive the patient to and from the hospital? Who is going to be the person negotiating health insurance claims? Who's going to be the person who keeps track of doctor's appointment notes and makes sure that you're taking your medications on time? All of that is just as important, I think, as making sure the patient understands what's happening. And I do believe that, especially when you're confronted with a life-threatening illness, it can end up making the difference between surviving and not surviving. So I learned a lot in watching my medical team educate my parents. When I underwent a clinical trial, they even trained my mom to administer some of the chemotherapy injections, so I could spend at least a week at home. And so I think it's important for us to, when we talk about the patient perspective, to widen that lens to include caregivers. And if a patient doesn't have the privilege of having a caregiver, making sure there's someone in place who can stand in for that caregiver.
Yeah, Suleika, a big element of the cancer journey that's often overlooked is survivorship. And you talk so eloquently about that already. And again, from my personal perspective, I lost a very dear friend 3 years ago to what started out as cervical cancer. But very much from the moment that she was diagnosed to when eventually she succumbed to the disease, she survived through that whole period. That was a journey of survival for her. She was never a victim, and she'd never lost any battle or anything. And I'm wondering what you think needs to be kind of promoted about this concept of survivorship.
So I think when we talk about cancer, we're, rightfully focused on a cure. But the reality is that for those of us who are lucky enough to survive, the hard work of healing does not end with a cure. In a lot of ways, it's where it begins. And I learned this the hard way. I spent 4 years, the better half of my 20s, undergoing chemotherapy and a bone marrow transplant, and then a clinical trial and more chemotherapy. And by the time I emerged from that experience, I was technically, no longer a cancer patient, but very, very far from being the happy, healthy young woman I'd hoped to be on the other side of this. And we talk about reentry in the context of veterans returning from war, but we don't talk about it as much in the context of what it means to survive and the cost of survival and what that means for recovery and reentry for patients who are coming out of cancer treatment. And the thing I kept coming back to in those first couple of months after treatment, where I felt so profoundly lost, I couldn't return to the person I'd been pre-diagnosis. I was no longer a cancer patient, but I had no idea who I was. And I was still grappling with the physical side effects of my treatment. I was grappling with post-traumatic stress disorder because of that experience, but I didn't have language for it. And I didn't have treatment protocols or discharge instructions. And so it really felt like I had been surrounded by this cavalry throughout my time in treatment, but in the aftermath of that experience, I was suddenly on my own. And the thing I returned to was that the thought I'd had when I was at my sickest, which was, if I survive this, it has to be for a reason. It has to be to live a good life, a happy life, a meaningful one. Otherwise, what's the point? And I think there's a lot of work that we have to do in terms of not just curing patients, but and making sure that they're feeling well, but that they're actually living well in the aftermath of these experiences. Among my friends in the cancer community, I've watched young adult patients get double hip replacements in their 20s and 30s because of the erosion of their joints due to the chemo. I have another friend who suffered a double heart attack at age 33 because of the radiation he received to his chest. So I think we need survivorship care plans in place.
Yeah.
For patients emerging from treatment. We need consistent follow-up to address not only any medical concerns that there might be or long-term side effects, but we need psychosocial support as well.
Yeah, well, if you're still, I don't think you are, but if you are still questioning who you are in the aftermath of cancer as well, I can tell you that from my perspective, and then I'm sure from all of the participants watching as well, you're certainly very brave and resilient and hugely articulate, and we are hugely the beneficiaries of that. So thank you very, very much, Suleika. We're going to come back to you because there will undoubtedly be lots of questions already coming in, yes, from viewers. But I want to turn now to Dave. Dave, you've had cancer twice, I believe, and you're the CEO of GRYT Health, which is a digital health company that helps advance the treatment, care and experience of all of those affected by cancer. And I know you've been researching a lot about the patient experience and, of course, leaning on your own experience as well. Tell us about this, about the hopes, the expectations, and, inevitably the disappointments that cancer patients go through.
Suleika's comments have inspired me to change what I thought I would share. And by that, I mean, I'm in Colorado right now, preparing to marry my girlfriend Ellis tomorrow in the Rockies because she's had a relapse and is now stage 4. And we want to start this journey together, all in. And what Suleika shared about considering the whole person and the team, the family, the caregivers around them is, I think, the most important thing I can echo. I was a researcher before I became a patient myself. And I studied how people learn things and how they make decisions and what inspires trust or erodes a trust. But it wasn't until I went through my own 2 cancer diagnoses in my 20s that I realized what I was studying wasn't the experience of people. It wasn't the whole of the humanity. And what we have to think about is not the disease, but the human and the ones who love them going through it. And so to me, being a researcher means being able to relate because I've been there and think more broadly about data points, but about the intersectionality of being human.
I can't believe you're getting married tomorrow. My congratulations to you in advance, and thank you for sparing the time. Goodness me, just before your wedding, to talk to us. But it is so important, of course, that we do speak to you when we consider now what is obviously the importance, the huge significance of the patient experience and all of this. I'm wondering whether what you think is more important or should be higher in the priority list. Is it the diagnostics or is it the individual experience?
I love how you just asked that question. There is no one size fits all answer, and there is no the experience. Experience is as unique as our humanity, and it is as unique as our fingerprints. And something that I would encourage everybody who's faced with a diagnosis, as well as all the humans who treat us, is to really think about what matters to that person. And, I think about what Suleika just shared about her doctor really getting to know her and getting to know her family. That is the most important place to start. I too lost my fertility in my 20s, and it wasn't part of the conversation because people were trying to save my life. And I don't know if that was a right or a wrong decision, but it wasn't my decision. And so the most important thing I can share is that for each of us, this is our journey, and we need to be equal partners in the conversation and in the decisions.
And because it's not just about saving a life, it's about saving a quality of life, right?
So much, so much.
Dave, tell us about this app that you've created that brings cancer patients and survivors together in one place.
Would be honored to. So the GRYT Health platform, you can visit us at grythealth.com, GRYT, and it is a place to connect and be around others who can relate to the experience. Everything we do is in one of three areas. It's connection, education, or advocacy. And we believe that when we're isolated or alone, everything is harder. So much of what we do is connect people to others who can relate, and to experts who are working in the disease areas they're facing. And then once connection happens, then we can work on educating and learning and sharing our voice. I would say that learning to share my voice and ask for what I need has been the most important part of my journey, which then enables us to become advocates, like Suleika has spent the last, the better part of her survivorship now is advocating for others. And so those three pillars, connection, education, and advocacy, are what we hope everybody that comes to GRYT can find.
And what are your hopes then for this World Cancer Leaders Summit, when you've got 600 of the cancer leaders on the planet kind of coming together, and you have their ear right now? What is your biggest hope? Are you trying to reach patients, or are you trying to reach the medics who can, and the innovators who can really make a difference for cancer patients going forward?
We believe that they are equal partners. One can't do this, can't survive, or can't improve quality of life without the other. And so most of the individuals who come to GRYT Health are patients and caregivers looking for support. But increasingly, we find medical professionals and providers who want to learn how to be more empathetic and learn how to relate to patients and work on shared decision making, and so many of the things that make this equal seats at the table. And so you asked the question, what would I say to all of the individuals who are here with us? The information that I would share is that I've been a patient experience researcher now for over 20 years. And anytime I think I know what a person is going to want or hope for, I am almost always wrong. It is when I ask questions and learn what is most important to them that we're able to really uncover where somebody hopes to go in their journey.
And that all comes down to time, I guess, doesn't it? Allocating time to really listen and learn from each individual, which, of course, in some cases, when you're dealing with emergency situations, then that perhaps there just isn't the time to really give that unique approach that each person really deserves.
I think if we get into the human aspect of what makes this so challenging, it is the element of fear. We all want to know how to act and what to do. And if my first action is to ask a question instead of try to know an answer, I can move in a direction that is closer to learning. And so regardless of how much pressure we're under for research or how urgent or acute the medical situation is, if we start with a question first, we've moved in a direction that is unique and personal. And so that's my advice, is that if you have the time for one question, start in that direction.
Okay. Dave, I'm going to keep you here for a little bit longer because we've got questions that have come in from the audience. Suleika's still with us as well, I hope, on the screen. Can I see Suleika? I think you're still there as well. If not, yes, you are. Oh, wonderful. Great. Okay. So first question, and Suleika, let me put this to you, if you don't mind. How do we ensure patients are being listened to, as Dave was just referring to, and how do you promote patient empowerment in their treatment journey, especially in relation to understanding treatment decisions? And Suleika, I guess this is relevant in particular with you when talking about, infertility, the fact that it wasn't brought up initially as an issue and you had to kind of navigate that yourself. How do we improve that experience for everyone?
Yeah, well, I just want to echo what Dave was saying and to add my own 2 cents in terms of a piece of advice, which is, we talk a lot about patient-centered care, but I really believe that isn't possible if patients aren't a part of that conversation. And rarely, though, increasingly, I see different medical organizations having a chief patient officer role, which is someone who has been a patient themselves, who's an advocate, who is a part of the conversation of how we can design this experience to be beneficial, not just on a human level for the patient, but in terms of diagnostic outcomes. As far as how we can make a patient feel listened to, I think, again, I'm going to sing the praises of Dr. Holland, my oncologist. Something he did, which maybe isn't realistic on the scale that he did it, but I think it's possible for any frontline worker, is that during that first summer in the hospital, I was inpatient for about 2 months, and he got in the habit during his lunch break of bringing his lunch and sitting next to my hospital bed. And he'd ask me questions about my life, what I'd majored in college, what I wanted to do after. And at first, I was a bit baffled by why he was taking the time to do this. But what I realized was he wasn't just making me feel like a person first and a patient second, but he was gathering information about me. He was getting to know me as an individual patient in terms of my goals and my hopes and my priorities. And so I think that's something that doctors and nurses and anyone who's interacting with patients should be doing, is not just getting to understand their disease, but getting to know them as a human being first. The other thing I'll add is that, coming from a journalism background, I was struck by how much medical intakes mirror a journalist's interview with a subject. All these questions that patients are asked, what is your pain on a scale of 1 to 10? How are you feeling? I think we need, in order to understand the answers to those questions and in order to make sure they're accurate, we need to understand what someone's relationship to pain is, because my 5 is very different to your 5. So again, it's taking those extra minutes to understand the individual patient in front of you, which maybe feels like it takes too much time, but I actually think in the end it saves a lot of time in terms of preventing misunderstandings and making sure everyone's on the same page.
Yeah, a lot can be learnt from the who, what, where, when, whys, and hows, I suppose. Just those basic questions, just to go straight in, as all journalists kind of have up their sleeve as well. And interesting, I love the fact that you talked there about your oncologist he should really be the sort of chief patient officer for everyone, it seems. Which brings me, Dave, onto a question to you from our audience as well. What role can patients play then in pushing innovative patient-centered solutions in their own care?
Wow. To learn as much as we can is always the start point. And what I would say is that when we first become a patient or we first become an advocate, we don't know all of the systems that are in place, nor all of the history and the reasons that were there. There is an expression that I try to remember in my work as a researcher and my personal life as an advocate, and that is that our ability to change a situation is directly proportionate to our understanding of it. And what that means to me is that I can get angry. I mean, in fact, I can be full of rage that I will never be a biological father, or that some of the decisions in my history I didn't feel like an equal partner in. I could live in that anger, but I choose to channel that into learning so that I can understand why things are done the way they are, in an effort to make things more engaged with the human who is going to have to live the results from the decision. And so my advice again to anybody is, whatever place you want to get involved in, or whatever point your voice is important, learn from others. I mean, it is an honor for me to be on this virtual stage with Suleika. When I was struggling to find my voice as a 2-time young adult cancer survivor, the things that I read from her and the things that she influenced gave me the confidence to make the impact that I'm making today. And so we can never underestimate how much each of us influence others to become a part of advocacy.
Yeah, that's really beautiful that you both have had a knock-on impact in a way on each other's outcomes and each other's happiness as a result of what you've experienced. I mean, Suleika, may I ask about the fertility question as well? I'm wondering whether you are particularly grateful and proud of yourself for navigating that road and having your eggs frozen, particularly when doctors weren't bringing it up as a relevant topic in the early stages of your diagnosis as well. Now, however many years on, when you're in your survivorship, do you feel particularly proud that you took that action when you did, and that you may well go ahead and use those eggs in the years to come?
You know, I do feel grateful, and I felt grateful in the moment at a time where the future felt scary because I didn't know if I was going to exist in that future. It felt like a tangible lifeline. It felt hopeful. But I wish I didn't have to feel grateful. I wish it hadn't been an issue at all. I wish it had been something that we talked about together. And I think, you know, the infertility piece is just one of, you know, one small example of the ways in which there's so often a communication breakdown between patients and their medical teams. You know, another example that comes to mind is around clinical trials. I was in a phase 2 clinical trial, but the only hospital offering it was a 4-hour drive away from my parents' house where I was living. And so understanding, you know, not just what someone's goals might be in terms of fertility, but understanding, you know, their geographic barriers to access, understanding their financial situations, all of that, you know, isn't, you know, some kind of wishy-washy, like, let's get to know the human. I really do believe that it's critical in terms of connecting patients to life-saving medical treatment. And like you said, it's the difference between saving a life and saving a quality of life.
Yeah. And Dave, if I can ask you, one of the questions that's come through is, what would have been one aspect of your treatment that you would have liked to see improved? Would it have been the fertility aspect, or perhaps something else?
That is an ocean of a question. I think that beyond just any individual decision or experience I found myself in, I never had the history or the knowledge to be a part of the conversation. And now, you know, this many years on, 2 cancer diagnoses, and now going through a stage 4 diagnosis with Ellis, what I've learned more than anything is how to find courage to ask things without necessarily knowing the right words or knowing if I'm asking them the right way, but to show up for the conversation and to let the things inside of me come out. And most importantly to me is to let others share the things inside of them that they don't know the way to ask or say. And until we have those types of courageous conversations, we won't be able to get into, why is someone living? What is most important for them as a survivor to have in their life? These are the kinds of conversations we need to be having.
Dave, I instruct you now to go and have a drink and get ready for tomorrow and have the most wonderful day possible. And congratulations from the World Cancer Leaders Summit to you, and of course to your wonderful fiance as well. We're so grateful for your time. And Suleika, my advice to you is to go out and continue being gloriously articulate, have loads of fun. And thank you so much for sharing your experience and for educating us all on this really, really vital topic. My enormous thanks go to both of you.